I'm Dr. Daisy Smith, and I'm a practicing general internist and the VP of Clinical Education at the American College of Physicians. I am so happy to be speaking with you today about practical steps that we can take to improve the medical education ecosystem. And I wanted to start by talking about what we've learned over the past decade about forests. So historically, our understanding about forests were that it was a place of competition where trees competed with one another for light and resources, and that the tallest trees were the ones who were the most successful because they had more access to light and water, and they grew at the expense of other trees within the forest. It's not surprising that this was our perception or the construct that we were with, because we were focusing on what we were seeing sort of above the ground. So about 10 years ago, along came a budding ecologist, a forest ecologist named Suzanne Simard, who was from the University of British Columbia. She was the daughter of loggers, so grew up in the forests of British Columbia, watching forests get clear cut and then replanted and logs processed. And she decided she wanted to devote her career to better understanding the ecosystem of the forest, and also to try to preserve what forests we had left. So in her research, she's made some really surprising discoveries about this ecosystem that I want to share with you. So she focused her attention on what was happening below ground, around the root system. And what she and her team found is that the trees were connected in a forest through a series of roots and fungi that lived along the roots. And they are called, this network of fungi are called the rhizosphere. And that the trees didn't end up competing with one another for resources. They used this network of connections in the rhizosphere to share water with one another, to share nutrients, and to share information. So trees could send distress signals to one another about drought, about disease, about what they needed. And as she did further research, she found, like that tall tree I showed you before, that there are mother trees within a forest whose sole purpose is actually to send nutrients to small sapling and seedling trees, so that they can invest in the next generation of the forest. And in her TED Talk, if you guys ever want to see her TED Talk, she describes mature forests as complex adaptive systems, where it's a system where all living things within it work together to promote the overall health of the ecosystem. And I think medical education has the capacity, unyet realized, to become a complex adaptive system. But in order to do this, we have to focus less on the individuals, less on the perfectionism and competition of our current educational system, and more on the overall health of the system and its future, which are really you all, medical students and residents. You are the future of the US healthcare system and our most valuable resource, and we need to start treating you as such. We have a number of challenges and opportunities ahead. The pandemic has been a huge source of stress on the healthcare system. And Mark Linzer and colleagues did a national survey of all healthcare workers in between June and December of 2020, and found that 1 in 5 physicians are considering leaving clinical practice within the next 2 years. So the pipeline has never been more important and more relevant than it is now. In addition, if you look at statistics from the census, you can see that this is also in the face of a rapidly aging population. So per the census data, by 2040, 20% of the US population will be over the age of 65, and those people are going to need doctors caring for them. So I think the time is ripe for sort of radical transformation of our culture and our medical education system. And we, as ACP and educators, want to partner with you to really transform the system so that it better prepares you to serve patients and one another in the future. So how to do this? I came up with a couple of tips for our 15 minutes together. The first tip is really to take time and make time to support and nurture one another. Medical training is hard. There is so much to learn. The learning environment is stressful, the stakes are high, but I think we make it harder than it has to be by isolating ourselves, by buying into the narrative about survival of the fittest, the tallest tree, etc., that we're in direct competition with one another, and not really allowing ourselves to show up for one another in the way that we need to support the learning process. So I guess my request to all of you is to really commit to showing up for one another in the learning environment, and to show up for those coming behind you, to be kind, be supportive, to be the resident and attending you wish you had when you were a student. So instead of sort of perpetuating the myth around, you know, competition and survival of the fittest, really committing to changing the culture one interaction at a time. And I wanted to share, one of my friends from college shared this paper with me because I do not normally read the Journal of Experimental Social Psychology, but this experiment was published in 2008 in their journal. And she knew I was very passionate about the power of teams, because I really do feel like the sky's the limit when you have a really high functioning team and what you can accomplish. So this study, they asked participants to stand at the base of the hill and estimate how steep the climb was going to be. And it turns out that the hill appeared steeper when they were standing alone than when they had a friend beside them. And relationship quality actually mediated the effect. So the more supportive the relationship was with the person standing beside you, the more doable the climb seemed to you. So I use this to tell you, don't worry alone, and try to build a team of supportive folks around you, and this will make the training and education process better. So my second tip is stop expecting yourself to be perfect. Perfectionism is both toxic and rampant in medical education. And it's so ironic, really, if you think about it. Like, I know we're all type A personalities in medicine, but the bottom line is, like, if you knew everything already, you wouldn't need to spend a gazillion dollars or your youth on medical school and residency training, right? So the idea is to really replace this perfectionism with the concept of the growth mindset. And Carol Dweck, who's a professor at Stanford, defined this in a book that she wrote. And it's really this belief that the skills that you have can be improved if you focus your time, effort, and energy on filling your gaps, and really being very deliberate about learning from experiences, particularly negative experiences. And I want to share a story that sort of illustrates the unintended consequences of perfectionism that happened during my residency training. So when I was I was an intern. This was like February of my internship. I had a really busy on-call night. I had just transferred a patient to the ICU, and I had 2 patients waiting to be admitted in the emergency department. And as I was going out of the ER, I got paged to talk to one of the patients on our service who wanted to talk to me about his diet order. So I was feeling really stressed and frustrated. I wanted to do the best job on my new admissions. I was already feeling a little defeated that one of our patients had gotten sicker and needed to go to the ICU. And I was just super stressed out. So the patient was a middle-aged man who had non-insulin dependent type 2 diabetes and obesity, who was admitted for IV antibiotics for the treatment of an osteomyelitis in a leg wound he had. And back then, when diabetic patients got admitted to the hospital, we put them automatically on like a calorie restricted ADA diet. And he was unhappy with that. So anyway, here I was with my 2 patients waiting in the ER, and I walked into his room just sort of loaded for bear. Just kind of barged right in and started talking to him about how important it was to make sure his sugar was under control so that we could adequately treat his infection. And he said, "Stop right there, doc." And I was a little taken aback. He said, "I want you, doc, to walk out of the room, put the baggage that you walked in here with on the ground, and come back in here and treat me like a human being." And I didn't even know what to say. Like had been so in my head about everything that was on my list. He was right. And I turned bright red. I felt like I was about to burst into tears, but I did what he said. I walked out and metaphorically put down the baggage that I'd walked in there with, and I came back in, and we managed to have a really constructive conversation. I can't really remember because it was a long time ago what I did, but we had a constructive conversation, and we were able throughout his hospitalization to build a sufficient relationship that he actually requested to follow up with me in my continuity clinic after he was discharged. And I think the reason I'm telling this story is because first of all, I've told this story a couple of times now, but it took me 20 years because I was so ashamed of being called on my attitude and how I kind of let this patient down that I didn't ever tell anybody for 20 years after it happened. So perfectionism and shame do come hand in hand. But I was proud of myself in that moment that I was able to answer, when he called me on it, to change my approach, to go outside, to leave the baggage and come back in. And that is replacing sort of perfectionism with a growth mindset. So I'm giving you tips to do, but I want to make sure that you understand that you're not alone, that ACP is here with you, and that we have a lot of resources. Think of us as the mother tree. We have resources to help support medical student well-being, and I've included in my slides links to medical well-being resources, as well as brand new resident well-being learning hub. And coming soon, we're in the process of producing a series of very short videos from your peers, giving you tips on how to advocate for yourself within our existing system. So please stay tuned for those resources and take a look at what we have already. So in summary, I want to say medical students and residents are the future of our healthcare system. You are valuable and you matter. Don't worry alone. Take time to show up, support, and nurture one another and all those who come behind you. Stop expecting yourself to be perfect. Never hesitate to ask for help, and really focus on learning from experiences, particularly those negative experiences have a ton to teach you. And remember that ACP is here to support and partner with you on this transformation of our medical education ecosystem. So thank you so much for this opportunity to speak with you today. And I wish you all the best. And I hope our paths cross in the future. Thank you.